Joining us now is Sean Connaughton. He's the president and CEO of the Virginia Hospital and Healthcare Association and a fellow passenger with me on the 2020 Trump train. Now, he's going to give us right now the skinny on what's happening with healthcare at the General Assembly. We're going to talk to you about some new statewide poll numbers VHHA released this week. And also we're going to talk about the fact that we now believe, as the president said, he can win Virginia. I think Trump has an outside shot to carry Virginia. We're certainly going to do our part to see that done. Sean Connaughton, welcome back, sir.
Hey, good. Well, Happy New Year, John. I think it's the first time I've been on this year, so it's great to be back again with you.
Okay, before we get to business, how's your lovely wife?
My wife is fantastic. She's up there in beautiful Northern Virginia right now. But yeah, no, we're doing good. Kids doing good. My son's over in Afghanistan right now, so we're just waiting for him to come home. So that's sort of our big. That'll be our Christmas gift late.
Well, you know, we've been fighting hard to get all our kids out of there. Hopefully, we can do that sooner rather than later, and hope your son stays safe and gets home quickly. And we appreciate his service to the country, Sean. I mean, it's tough as a father having one of your kids over there, not knowing day to day what happens. So I know it's stressful. So hopefully he'll come home. He'll come home soon, Sean. You know, several of the things that you mentioned that we talked about earlier offline a little bit. I mean, there's so much happening in the Capitol in Rich Vegas these days. The Democrats are working overtime to restrict our Second Amendment rights, upend years of culture and tradition in Virginia, and they want to pass all these new laws. While people have a lot of feelings on this, Sean, let's not lose sight of the fact that there's other important issues being decided in the state assembly, including some big healthcare issues. This is why I wanted you on today, because, you know, they're kind of falling by the wayside. We're talking about gun grabbing and all this other stuff, right to work. Nobody's talking about the healthcare issues, right? So give us an update, Sean, if you would, on some of the big healthcare bills that you're watching in the 2020 General Assembly.
Yeah, and John, and your point is right on. I mean, if you look at any of the polls, and if you just from your social circles, talk to people, healthcare remains one of the biggest issues, biggest concerns for everyday voters. And, the General Assembly is dealing with a lot of issues that are maybe new to Richmond, or the fights about them are newer to Richmond, but they are still working on a lot of very, very important healthcare bills, things like Certificate of Public Need, looking at balanced billing, looking at some of the practices of the insurance companies, working to deal with the trauma center. One of the things that ended up happening last year, that when the governor did go and erase all the fees for, penalties for DMV, for reckless driving and things like that, it actually took away the money for trauma centers throughout the state. And so we're working this year to make sure we get our money back so we can continue to serve the people of Virginia in any sort of, whenever there's any sort of accidents or natural man-made disasters. But this work is continuing. I mean, we're there working with a lot of our healthcare and hospital stakeholders, as well as others out in the community, to make sure that we can continue to deliver good healthcare, quality healthcare to the people of Virginia, and find a way to reduce the costs that involve, particularly in what we're seeing that's happening in the insurance industry, and what is ever increasing costs of health insurance that do not at all match the costs of what is happening in healthcare. So our poll that we just did, you just mentioned, I mean, it goes out to show you some of the, where people stand in the state. We piggybacked onto a Mason-Dixon poll, and Mason-Dixon came back a very credible poll, so people can't question the numbers. But, things like balance billing, surprise billing, that's where sometimes people end up going to an emergency room. They have to bring in somebody who might not be in the insurance network of the insurance being held by the person who's had an accident. Patients should not have to deal with that.
Exactly.
This should be a fight. This should be a fight between the provider and the insurance companies. But you think about this, you and I and people across the state are spending thousands of dollars a month for insurance plans. You go to an ER, and all of a sudden, because one doctor may end up not being in that insurance company's network, the insurance company might not pay and tell you, the patient, that it's your responsibility, and that's ridiculous. And that's one of the things why we've been pushing for bipartisan legislation. In fact, last year passed 40-0 in the Senate and actually got through the major committees in the House, but ended up dying in the last bit of the General Assembly last year. We're pushing that legislation again that will take patients out of the surprise billing conundrum and end up making it essentially a negotiation between the provider and the insurance company, which is where it should be to begin with. And you know what? Overwhelmingly, people in this poll, overwhelmingly end up saying that we should end up with a proposal or legislation that's closer to what we are pushing in the healthcare industry versus what the insurance companies are pushing.
Well, Sean, I'm glad you brought that up, the surprise billing issue, because I've been covering that nationally now for about 6 months. By the way, we're with Sean Connaughton. He's the president and the chief executive officer of the Virginia Hospital and Healthcare Association, acronym VHAA. Sean, the surprise billing thing is real to a lot of people, and with impeachment and guns, it gets just pushed aside. But there are so many listeners that we have, including me, who got home one day and I got a bill in the mail for $7,900. I had a colonoscopy with a few polyps or something. I get a bill for almost $8,000. I have no idea what it is from the hospital. No clue. Yeah. Go to my insurance company. Well, they went to an out of provider or something. I had no knowledge of that. And, if you don't pay it, what happens? They get a judgment, it hurts your credit. The thing is a nightmare. And, how do you get a bill that you had no idea that you were even a party to that? So I agree with you. Surprise billing is a big issue, both federally and in the state. And, hopefully we can get something done on that so this nonsense stops. I've got a couple other things I want to get to, but I just want to take an aside here for a second. Both of us were proponents of Medicaid expansion in Virginia. Certainly I was. I got a lot of heat for that, but I thought it was the right thing to do because this is for working class Virginians that are working 2 and 3 jobs and were falling in the cracks between Obamacare subsidies, Medicaid. They made too much money, but they didn't have enough money to buy insurance. You were a proponent of that. 6 months in now, is that meeting some of the expectations that the Hospital Association had?
Yeah, and John, listen, and we appreciate very much your support for that, as well as Virginians across the state. In fact, we saw a groundswell of support among Republicans and Democrats for Medicaid expansion because it's ended up providing health care to, I think now the numbers are almost 350,000 people. And these are our friends, these are people who can't afford necessarily to be able to purchase commercial insurance or don't have employers who can provide that insurance. Mm-hmm. And, we are just seeing a dramatic increase in the number of people coming in, being provided service. And we are actually starting to see some of these health outcomes already starting to have a positive effect on the state. And so we think it's been a great success. Obviously, unfortunately, up in Washington right now, there's things like Medicare for All that really we are very concerned with. Right now, I think in Virginia, 93% of the people have insurance, whether through their employer, through commercial insurance, through Medicaid, Medicare. Let's focus on that 7%
exactly
that don't have coverage. Don't blow up our insurance that are our healthcare system.
Crazy.
For the 93% who right now have coverage and actually are able to get health care.
Sean, is that 93% number, Virginians that have health care, is that one of the highest in America?
It's pretty high up there. There are actually some other states that are a little bit higher. So we are constantly looking for ways to provide coverage. But the great thing is everyone knows that, Virginia's hospitals and health systems provide care, emergency care, to people regardless of their ability to pay. And, they're there in case people really need urgent care. But obviously, it's the preventative care that's important to get to make sure that people are, don't get those sort of chronic conditions, don't end up having what could start out as a minor issue turn into a major issue. And that is where things like Medicaid expansion and some of the other programs that we're pursuing end up actually providing that type of care.
Wow. Well, we fought the good fight. I still defend Medicaid expansion. And I just want to point out to our listeners, too, those 350,000, 85% of those are Trump voters that voted for the president because they believed that this president would help fix the system, and they're working people. So just want to keep reminding everybody of that gets upset over it. Sean Connaughton with us, president and CEO of the VHHA, Virginia Hospital and Healthcare Association. Several things you mentioned, balanced billing, certificate of public need, are also issues I've discussed for years, and my position is clear. Look, you can't have a healthcare system where the government requires hospitals to provide free care to the poor, what we call indigent care, uninsured people, without safeguards in place to ensure that all providers are invested in charity care. And what drives me berserk about certificate of public need and those of my conservative brethren that want to die on this hill about free market competition, and we should get rid of COPN. If somebody wants to open up a medical facility, they should be allowed to do that. It's unfair competition because the hospital, I can't seem to get conservatives to get this. If you have a hospital, that hospital has to have an emergency room. That emergency room has to take anybody who comes in at any time, under any circumstance, by law. You know who signed it, Sean? Ronald Reagan. He signed that into law. They can't turn anybody away, whether they can pay insurance, no insurance, whatever it is. They have to take them. They have to care for them. That is millions and millions of dollars for a hospital in some areas. So what happens is if you get rid of certificate for public need, guess what happens? Medical corporations, these are not mom and pop, some doctor. These are corporations who come in to the area. They don't offer emergency room service. They don't offer all the things a hospital does. They only offer the most high margin, profitable things like an MRI and things like that. So they cherry pick. They underprice the hospital. The hospital needs that in order to pay for everything else that the government mandates they have to have. So there's no competition. I cannot get people to understand this. And every time COPN has been taken out of a state, guess what happens? Rural hospitals, it's happened in Georgia, it's happened in South Carolina. Guess what happens to them, Sean? They go out of business. I mean, this is as plain as the nose on your face. Why can't I get conservatives to grasp this concept?
John, I mean, and
am I right?
No, you're exactly right. In fact, I couldn't say it better. I mean, what makes healthcare so difficult is for people maybe to get their arms around it is that there isn't a free market in healthcare. I mean, because hospitals and the health systems that are around the hospitals, like you said, they take all comers. And in fact, if you look at the payer mix, what we call the payer mix, 2/3 of the patients in our hospitals today are Medicare, Medicaid, or essentially free care, charity care. Now, if you look out in Virginia right now, about 2/3 of the people in the state have commercial insurance. And so right now, we are seeing, especially we think about it, older people, Medicare, Medicaid, are those with lower incomes, then those with essentially no incomes get charity care. I mean, these are people that right now are using the system. And what they're trying to do, I mean, this is what the proponents are trying to do, is take that 1/3 of our patients who are commercial patients and take them out of the health system because we have to take these other patients. And the challenge we have is, we won't be in existence. right now across the state, and we know we have the numbers, we can show that in the majority of communities in this state, one of the largest employers is the hospital and health system. And if you take that away, you will see, right now we have serious challenges in rural Virginia and in some of our urban centers. You take away that hospital, not only will you take away a major job generator that brings in very high-end, very high-skilled jobs, you will never see economic development in those communities. You will never see it. Mm-hmm. No one is going to move a major facility, a plant or warehouse, anything, to a community that doesn't have a hospital. And so in some ways, this argument that here we are spending billions of dollars to attract companies like Amazon, yet at the same time, some people are working to undermine the very communities that put the money in to essentially attract Amazon, which is just ludicrous.
Makes no
we
sense.
have to find ways to buttress our health system,
mm-hmm.
particularly in, and I'm going to say this again, rural areas.
Right.
We are seeing, obviously, a much higher proportion of people who are elderly who are on Medicare, on these other programs. So mm-hmm. let's find ways to strengthen the system, stop trying to fight for ways to undermine it.
We're with Sean Connaughton. He's president, CEO of the Virginia Hospital and Healthcare Association, giving us an update on healthcare in Virginia, what's going on in the General Assembly. Sean, you mentioned rising insurance rates. Can you elaborate?
Yeah, John, I mean, we don't understand what is happening. I mean, we can show numbers that, essentially the price increases for hospitals and health systems is going up about 2% a year, just around inflation. Yet insurance premiums are going up double digit. I mean, and you step back and you look at what the plans they're selling. In fact, one of the questions we asked on the poll that we just did, mm-hmm. and it mirrored, which is just to validate the answers in the poll. Right now, it's estimated 40% of the people in this country have these high deductible plans, mm-hmm. plans that require you mm-hmm. to spend $4,000, $5,000, $6,000, $8,000 out of your pocket before the insurance company, who you're paying thousands of dollars to mm-hmm. a month, will even pay one claim. And so when we ask this question, nationally it's about 40%. Our poll came back at 39% of the respondents said they had a high deductible plan. And then when you go and ask them the next question, have you deferred any health care because of this high deductible? And something like 40-something% said yes. Mm-hmm. And so where is this money going? You're right. Spending all this money. You're seeing premiums going up. You're getting these narrow networks. One of the reasons we're starting to see a rise in, this balanced billing is because they are narrowing it and more narrowing the doctors that you can go see.
Right.
And where is the money going? I mean, we just step back, and we are hoping that with the state this year now looking at potentially creating a state-based insurance exchange, that they can start to ask some of these questions mm-hmm. regarding this high cost of insurance mm-hmm. and what is happening, why we're seeing this complete divergence between how much we're paying the out-of-state insurance companies and how much we're really seeing the costs increase for actually the provision of health care. And I can tell you on behalf of my members, every time we figure out a way to lower our costs, we don't see any commensurate decrease in your premiums. So where's the money going?
No one knows. I mean,
yeah,
that's the thing. No one knows where the money's going. And
John, right now, you can go on a website for California. I can't believe that I'm sitting there pointing to something in California, but I'm telling you right now, in California, they have a website that you can go in there and see exactly how much every insurance company is making on every service line. It's all there. Mm-hmm. You can look at it. In here in Virginia, it goes into that, into the State Corporation Commission behind closed doors. We have no idea what is happening and where the money's going.
Right. Well, or what the insurance markup is, or who they're paying. I mean, it's the non-transparency of this system is really what is driving people nuts. And you look at this Mason-Dixon poll, and I'm running out of time, Sean, but I mean, some of these numbers are stunning. 53% of Virginians say certificate of public need should be maintained. Only 14% want it out. That's 4-1. You look at the other thing, 2/3 of Virginians express support for the current healthcare delivery system with COPN in place. A vast majority of Virginians want something to be done with balanced billing. They want surprise billing, and they want transparency. And that's what you just said. We ought to be able to go on any site and see, this is insurance. It's, people have to have, what is the cost? What are they making? What are they charging? What are they paying? Because it's all over the board.
And, John, you could do that for hospitals right now. You can do that right now. The state has a thing called the Virginia Health Information Office. You could see that for hospitals. You can't see that for the insurance companies. Why not?
Because I had a question here from Amy in Fairfax. She said, could you ask Sean Connaughton if hospitals publicly post their prices?
Yes, we do right now.
Yes.
In fact, you can go on. We have a thing called Price Point. You can go onto our website, www.vhha.com, and you can actually see ours. And actually, we have various requirements for the hospital. Again, just hospitals to go out there and publish our rates. And we're trying to get better with it. The challenge is it's and this is again one of the big challenges is what we charge is not what necessarily you with your insurance plan will actually pay. Mm-hmm. And each plan is different. Each negotiation is different. But we do charge and put up our charges on our website here for our members, and actually you can do it for each individual hospital as well.
All right, and then final thing I have to say, I got a text here from one of your fans, Ben Knotts, who's the legislative the legislative director for Americans for Prosperity. Sean, I got to read you this funny text by Ben. He says, Ben, the legislative liaison for Americans for Prosperity. He says, Sean, fake polls.
I don't think Mason-Dixon, and you know what, unlike fake polls, we actually sent out the questions and the answers and the breakdown. So if he would like to go and take a look at it, in fact, I can send it to him personally if you'd like. I mean, because it is, again, it's all about transparency, and that's what we're about. And we're going to try to work together, and we're going to work with you, John, and all your listeners to make healthcare better and more cost-effective in this state.
Hey, final question. We're also a proponent of telemedicine, like doctors being able to prescribe and counsel over an iPhone and getting nurse practitioners to be able to do that, going across state lines. Have you guys fleshed out any position on telemedicine at all?
Yeah, no, John, we're very supportive of it. We think it's great. We try to support it, and actually many of our systems have telemedicine already in place. It's been a challenge for a couple of reasons. One thing is it's about reimbursement for getting paid, whether for the government or for the commercial insurers to actually provide that service. Another big issue has been licensing and, across state lines or whichever. And then who's actually providing the care. So these are things that we're working to address. Believe it or not, there is an actual telemedicine center out in UVA, which is one of our members, and they're working to improve what we have today to make it even better out into the future.
All right, Sean Connaughton, we're out of time. I really want to thank you for that great update.
Hey, John,
Sean Connaughton.
wait, one thing, John.
Go ahead.
One thing. I got to give a shout-out to Ernie, our UPS man. He is a big fan. He ended up pointing out to me that he is a big fan. He said all the UPS drivers here in Richmond are big fans of John Fredericks. So going to give him a big shout-out.
Ernie, baby, go. John Fredericks Show, Godzilla of Truth for UPS, Ernie. You're the man. Thank you. Spread the word. I really appreciate it. Sean Connaughton, President and Chief Executive Officer of the Virginia Hospital and Healthcare Association. And by the way, these are not fake polls. This is Mason-Dixon. And if you really understand the markets, COPN is the best thing we have, because otherwise rural hospitals go out of business because it's cherry picking. John Fredericks Radio Network.